Welcome to Black Women's Health, a podcast dedicated to the health and healing of Black women. I'm Dr. Rahman, and I am a board-certified OBGYN. This segment of the podcast is an opportunity for me to explain various aspects of gynecologic care. A common complaint is abnormal uterine bleeding, and the causes for abnormal uterine bleeding are multiple. I want to explain the process of how we evaluate abnormal bleeding so that if you or someone you know is experiencing this problem, they will know what to expect. Additionally, this can serve as a checkoff list for you to make sure that the doctor or the nurse practitioner is giving you a complete evaluation. Or if you have a question, you can then pose the question and ask the rationale for why the providers are doing what they're doing. There is an acronym that we use when we evaluate abnormal uterine bleeding, and that acronym is PALM-COIN, PALM hyphen COEIN. Each letter represents a possible etiology for the abnormal bleeding. I will use the next several weeks to discuss each letter and what it represents and how it may be responsible for the abnormal bleeding. But before we get into PALM-COIN, let's talk about preliminary evaluation. When you present with abnormal bleeding, we need a history. We need a history because we need the specifics. What is a typical menstrual cycle like? Why are you calling this bleeding abnormal? Is it abnormal because it's coming too often? Is it abnormal because it's too spaced out? Is it abnormal because you're bleeding in between periods? Is it abnormal because you're bleeding after sex? Or is it abnormal because of the number of days that you're bleeding? Or is it abnormal because of the amount of bleeding that you're doing? We need the specifics. We also want to know, when did it start? How long has this been going on? In addition to getting the history of the abnormal bleeding, we want medical history, including medical problems, surgeries, medications, family history, because there are GYN and non-GYN causes for abnormal uterine bleeding. Then there's the physical exam. You will need a pelvic exam. Usually, it's advised not to go to the GYN when you are actively bleeding. In this situation, it's good to go to the GYN when you're bleeding. It helps the GYN to gauge the amount of the flow, the amount of the bleeding. Is it bright red or is it dark brown spotting? Are there associated symptoms such as pain or tenderness? All this helps in our evaluation. The next step would be to see, one, are you iron deficient because of this bleeding? Or do you have iron deficiency anemia? So now we have a history, we have a physical exam, we may have sent you for the baseline labs, and now we have to go through the acronym PALM-COIN to see if we can identify the cause for your abnormal bleeding. We will start with the P in PALM. P is for polyp. These polyps are sometimes called endometrial polyps because it is a growth of tissue is attached to the endometrium or the lining of the uterus, which then protrudes
This is not
into the
what the
cavity
cavity of the uterus looks
Usually
like,
this
but this is a
polyp
good
is
picture
attached to the
of what a
endometrium by a
polyp
stalk.
would look like.
Polyps are fairly common, and not all uterine polyps cause abnormal bleeding. The majority of polyps tend to be benign, and small polyps have been known to regress over time. The presence of a polyp is usually suspected whenever a mass is seen within the cavity of the uterus when a pelvic ultrasound is performed. However, the ultimate confirmation of a polyp is based on histologic examination, meaning the mass has to be removed, sent to the pathologist for confirmation. Not all polyps cause bleeding, and as noted earlier, some polyps regress spontaneously. If you are symptomatic from a polyp, i.e., having abnormal bleeding, polyps can be removed either via in-office or outpatient hysteroscopic resection. This is Dr. Rahman, and I look forward to talking to you next week about other possible causes for abnormal uterine bleeding. Please, if you found this helpful, share, send a review. I look forward to the next time. Take care.